Welcome everyone to the second webinar in the Passages Digital Speaker Series. My name is Scott Phillips and I'm the Executive Director of Passages. For those joining us who are not alumni of our program or just aren't familiar with what we do, we're a nonprofit organization that takes Christian college students to Israel to discover the roots of their faith, introduce them to modern Israel, and help to develop the next generation of Christian leaders. It's my great honor tonight to introduce our guest today, Dr. Nathan Thielman. Dr. Thielman, an infectious diseases physician, is professor of medicine and global health at Duke University, the author of over 150 articles and book chapters. His research primarily focuses on critical issues that affect persons living with HIV infection. During the 2014 to 2016 Ebola outbreak, he helped to lead clinical trials in West Africa to advance treatment options. His commentary on lessons learned from conducting Ebola clinical research in Liberia and Sierra Leone was published in the journal Clinical Trials and is applicable to the current COVID-19 pandemic. We're particularly excited to hear about the intersection between Dr. Thielman's Christian faith and his work. We'll start with some questions we prepared for the doctor, and at the end, we'll try to take some questions. So if you have a question, please do submit that in the Q&A box at the bottom of your screen. Dr. Thielman, thank you so much for your time tonight. It's wonderful to have you joining us for this important topic. The first question we have for you today is, what is COVID-19 and what makes it unique?
At the time, there was serious consideration that these viruses would spread, but they seem to be quite limited and they kind of burned out. Look at I think you might be able to see my pointer, I don't know. Yeah. But the number of cases and the mortality there are shown on this fourth row. So about 8,000 for SARS-CoV, 2,400 or 2,500 for MERS-CoV. And now we're pushing 2 million for SARS-CoV-2. And the mortality rates were about 10% for SARS-CoV. A third of people with MERS-CoV died. And right now, the mortality rate is fluctuating. It kind of depends on the country that you're in and your age demographic, but it's averaging around 2 to 4%. And so that's a little bit of the background for the virus itself. Another point that I think bears some mention is its origin, and it's actually been in the news today. I was just watching the news before our visit, and from the beginning of this outbreak, there's been a lot of focus on these wet markets, if you will. Mm-hmm. And the one in particular in Wuhan was this Hunan seafood wholesale market. And what's shown here is in a figure from the New England Journal of Medicine that initially the high proportion of cases that presented, the first 47 cases before January, were all linked to this market in some way. And then increasingly over time, there were more cases that weren't linked to that market. It's also important to note that there were quite a few that initially weren't linked to that market. And so everyone's kind of talked about this market. There's this link to bats, which is very interesting in and of itself. And the thought is that this species may have jumped from a bat into possibly some other animal, perhaps a pangolin, which I'd never heard of before this, but it's a mammal, and then jumped into humans. And there's also some concern that there may have been other sources for this that actually I think bear some investigation that's in the news today. Mm-hmm. So that's a little bit about the background of SARS CoV-2. What else can I help you with by way of background?
Yeah, I think, what makes this virus so dangerous compared to, you went through, the other sort of the big, SARS type viruses. What makes this one so dangerous? It seems like a lot more people are getting it.
Yeah, for sure. I think there are a couple of things that are contributing to that, Scott. So First of all, it's novel. So our it 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 is a coronavirus, but it's unlike a lot of other coronaviruses, which means that there's no immunity at all in our bodies against this virus. And that's the scariest part about it, is that we have no immunity to it. So with the seasonal flu, we've all seen various flu bugs. We hopefully all of us are getting our flu vaccines. And so we have some background immunity, even if they didn't quite get the strains right for a given seasonal flu vaccine. There's some background immunity that may keep people out of the hospital, even if they get the flu. Well, there's none of that for this novel coronavirus. That's the novel part about it. So your immune system really, in the first days of illness, doesn't do you a whole lot of good against this virus. So that's number one. Number two is that the reproductive value for this, and now I'm going to get kind of nerdy on you if you don't
Go
mind.
for
Just
it.
indulge me for a second. So there's this, and maybe some folks have heard of this. There's something called the Arnott. And it's the basic reproduction number for a given pathogen, a given virus or bacteria or parasite. And basically what that means is if you've got one person that's infected with this bug, how many other people are going to get infected? And so a high number means that a large number of people are going to get infected from a single infection, and a low number means that fewer people will get infected. Once that number drops below 1, the epidemic starts to go away. And what's particularly concerning about SARS-CoV-2 is when persons are gathered together in pretty dense settings, such as on the Diamond Princess, that cruise ship that was in the news a couple of months ago, the R0 value was very high, almost 15. And so there was a lot of transmissions. So for every one person infected, 15 other people got infected.
Wow.
And you can see the R0 values in this graph for various other infections, including for SARS-CoV-2, once you kind of get away from the Diamond Princess. And we think that the median R0 is around 2 to 3-ish. Now, here's the thing about the R0 is we can change the R0. It's not something that's just completely intrinsic to the bug itself. And that's why social distancing is so important. Is because if we do all of those things, then we can change the R0 and change the trajectory of the epidemic. And then the last thing that I want to say about that is shown in this figure that I think is a very important figure for people to try to understand. And bear with me a little bit. So this is a figure from the New England Journal from relatively early on in the epidemic. And what's shown on the x-axis here are the days since the onset of symptoms. So when I first get symptoms, that's day 0 carrying forward. What's shown on the y-axis, and this is a little bit of a weird y-axis because you'll see the higher number is at the bottom and the lower number is at the top. And I don't want to get into too much detail, but this is the cycle times for a PCR machine. And the bottom line is the higher up on this number is, it means the more virus there is, because it takes fewer cycles to get a virus signal from the PCR machine. So where my pointer is here means there's more virus. Here there's less virus. And what's shown is that even very early on, before someone has symptoms or is early on in their symptom stage, they're shedding a lot of virus. And so that's what makes it so infectious. And even since this study came out, there have been a number of other studies that have shown asymptomatic transmission, meaning I don't have any symptoms at all, but I'm carrying the virus. So I think that's one of the things that makes it kind of unique and a big problem.
Yeah, absolutely. And I think, so based on that, we obviously see health professionals all the time. You see them with the, the briefings with the president or governors or local officials, things like that, who are there giving recommendations. Obviously, the government is giving guidelines. How do health officials determine the appropriate response to this?
Yeah, that's a great question. So it's very interesting that it's kind of humbling, actually, to realize in our super technological age that we have been kind of reduced, in a sense, to something so basic that actually it's the same intervention that over a century ago helped to quell the 1917-18 flu epidemic. So I got a figure here I got to show you that I pulled out of this book. And this is a book called The Great Influenza, the story of the deadliest pandemic in history. This, unfortunately, the subtitle may be altered because of what's going on now in terms of its accuracy. But what do you see here? You see people in 1918 wearing masks.
Wow.
And this was somewhere in California. It was actually a church gathering. And you'll read there that all public meetings were banned, all public gathering places, churches, schools, theaters, and saloons were closed. And that's how they actually mitigated the epidemic then. And that's what we're doing now.
That's amazing. Not much has changed in that way.
Yeah, yeah. So and it's really important message. And I think the other thing, Scott, that's important to know, and again, hopefully everyone kind of gets this concept, but it's the flattening the curve concept. And that's what we're doing now. And that's why I think we're finally able to see maybe some light at the end of the tunnel, is that these measures are working. And I can tell you, because I was on call last week and kind of in the hospital, and the level of anxiety among healthcare workers for being kind of overwhelmed by this epidemic is quite high. And it's been very gratifying to see the way that everybody has participated in trying to stem the tide of this epidemic. And I think we're actually winning. And it's really cool to see the nation coming together to say, this is a problem. Absolutely. Yeah, social distancing is no fun, but we're actually saving lives in the midst of a really difficult situation.
Yeah, no, that's it's great news to see that Americans really are coming together and realizing that this is a serious situation. People have heard maybe on the news or in other places ways to protect themselves. Maybe they've heard bits and pieces of how to do that. What are the most effective ways to protect ourselves from getting the coronavirus?
Mm-hmm. Yeah, no, that's a great question, and I think the key is to look at what the CDC has said, and I think the guidelines are clear. You want to wash your hands. You want to avoid contact with others. They say cover your mouth and nose when you cough or sneeze. Wearing a mask. I think it's actually now in the hospital we're all wearing masks, and when you go to Target or the grocery store, I think it's a really good idea to wear a mask.
That was my next question. When you go to the grocery store, you're sort of now a little bit paranoid. You've got to get food, and if you can't get it delivered, then you have to get it somehow. So you're saying wearing a mask. What about wearing gloves? Is there any kind of what's the risk when you go into a grocery store?
Yeah, it's a really good question. So here's the thing. If there's asymptomatic spread, and if the virus can be transmitted, and this is now documented by talking, sneezing, singing. There was an outbreak in a choir group in California, then wearing a mask is actually a really good idea. I know it looks a little weird, but it's a good idea right now. We're not going to have to do this for the rest of our lives, but until we get this under a little bit better control, I think it's just prudent to do that when you're out in a place where you're going to get closer than 6 feet to someone. So if you're going out for a jog in the woods, you don't need to wear a mask. But if you're going to the grocery store and you can't really control how close the person next to you is going to be, it's probably a good idea to wear a mask.
It was a little bit funny, maybe a couple weeks ago, before the president started talking about wearing masks and the CDC came out with sort of this advice. Going to the store, let's say on a Friday, the Friday before that happened, hardly anybody had masks on. Yeah. And my wife is very careful about germs, so she had a mask that her parents had left at our house at Christmas. And I was one of the only ones wearing the mask. I think it was Monday or Tuesday of the next week after the president and the CDC, the government said, hey, wear masks. It was definitely not, it was, before that you felt kind of weird and awkward wearing a mask, but if you weren't wearing a mask a few days later, you were sort of looked at like, why aren't you wearing a mask?
Yeah. I actually think that's, to kind of normalize it is a good thing right now. Do you remember the show Monk? Did you ever see it was about this detective who was kind of obsessive compulsive and he was a germaphobe. And I think I don't want us to go too crazy with it like for the rest of our lives. Mm-hmm. But I think right now being a little bit paranoid of germs is a good thing.
Not a bad thing.
Yeah.
I think we'll all have a little bit of a complex for years to come about shaking hands and all of these types of things.
Yeah.
What would you say, Dr. Thielman, how is your work on other crises like Ebola? What has it taught you about fighting COVID-19?
Yeah. So there's a book that I'm reading that I love. I'll actually hold it up for you. Can you see that? It's called the Rules of Contagion, and I'm about a quarter of the way through it. And there's a great quote in the intro to this book that says, "When you've seen one pandemic, you've seen one pandemic." And that is to say that like you don't kind of enter into this COVID-19 thing saying, I know what's going on here. That's why it's a pandemic. It's a tricky thing. It's kind of a lot of things are unanticipated. So, HIV is a pandemic and it is very different from what we're seeing now. That's intuitively obvious to anyone. Ebola was, thankfully very limited, devastating illness with a very high mortality rate, but very limited in West Africa.
Yeah.
And I have
limited, would you say, in its transferability? It wasn't quite as transferable, wasn't quite as contagious. Is that really was the difference?
Definitely. So, and because it wasn't a respiratory virus, so it's not, if I sneeze, I can transmit coronavirus, and that makes that R0 value go way up.
Right.
Ebola, you could get it by touching someone with Ebola, but you couldn't get it from them just kind of like coughing.
Airborne.
Yes, exactly. Yeah. So in that sense, it was easier to control. One of the cool things that I'm actually working on now, and I'm quite passionate about it, and it was the work that I did in West Africa, is I tried to help stand up a clinical trial that looked at Ebola convalescent plasma. So that is when you take people that have had this illness and they've recovered from the illness, then they develop antibodies. And you can actually take those antibodies from a survivor of Ebola and give them to someone who's acutely infected. And the thought is that may help in terms of treating. And that's actually something that I'm working on currently here, and a lot of other people across the country. You may have seen people kind of soliciting for COVID-19 persons who've recovered from COVID-19 to gather, donate convalescent plasma as a potential therapeutic. So I think we have learned some lessons from Ebola that are transferable to this.
How has your Christian faith impacted your work? Because you are, obviously it was wonderful being introduced to you a few weeks back when all of this started, and learning that there was a leading epidemiologist who was also a committed Christian, a committed believer, was really incredible, because maybe that's something we don't see on the news when we watch any of the news networks or see in the media. Is how can we have obviously an informed opinion on COVID-19 from a scientific perspective, but also look at it from a faith perspective. And we've got somebody who has both of these right here with us, with you, Dr. Thielman. So how has your Christian faith impacted your work in general as an epidemiologist?
Well, I mean, first of all, I just think for me as a physician, knowing that all humans are made in the image of God is deeply impactful. And so for me, that's kind of a really motivating when you're having a bad day and maybe you're actually treating a patient that's not expressing gratitude or is grumpy or whatever. You have to kind of pause and say, wait a minute, that person is made in the image of God. And this is someone who I need to love as Jesus would love. So I think that's a big part of kind of, I hope, the ethos that I want to show as a physician. And then as somebody that does research, I love to be able to ask questions and realize that all truth is God's truth. And if I'm seeking truth in the scientific sphere, or if it's epidemiology or whatever, that's really cool, because God understands it. And this is a way that we can kind of understand the world that he's created, even if it's these bad bugs and such. So I think in the background that's been there for me. But personally, I think a lot of us through this COVID thing have really had our worlds rocked. I think about students that were supposed to go to Israel and all of a sudden they couldn't go, or now they're at home taking classes online. And a verse that means a lot to me, and a number of years ago when I had just like an incredible disappointment in my life, was this verse. Does that show up on your screen?
Yes, it does.
Yeah. So this is a good verse to just think about. Many are the plans in the mind of man, but it is the purpose of the Lord that will stand. And so I firmly believe that God is sovereign, and that means that he's in control of these situations. It doesn't necessarily mean I'm going to get the outcome that I want, but he's in control, and he has promised his love for us. I mean, it's the same God who sent his son to die on the cross for our sins, and he loved us that much. If we recognize that he loves us that much, we've got to recognize that he's going to get us through this with his love. And so for me, to be able to reflect on that has been deeply helpful, just in the middle of a lot of uncertainty. Because if there's one thing about this virus in the last few months that I think all of us have dealt with, it's been our plans have changed and things feel very uncertain for us right now.
Yeah, that's obviously incredibly helpful, incredible perspective to have. How would you suggest that Christians ought to respond to this threat that COVID-19 poses.
Mm,
I think you went
yeah,
into that just a little bit just now,
yeah,
just having faith in the love of God and his
yeah,
plans for us.
yeah,
Specifically, what would you encourage Christians?
yeah. Well, thank you for that question, Scott. I mean, I want to say a couple of things. So, and I'm gonna blend science and faith here.
Great. They go well together.
So, I'm gonna show you another nerdy table. But I want you to look at this and think with me for a second about what it means to be a Christian, especially if you're in this demographic. So this is the case fatality rate by age group in Italy and China.
Mm,
And so if you're young, your chances of coming out pretty good with COVID. You can see that the number of deaths and the case fatality rate is pretty much zero if you're in your 20s.
wow.
But what about if you're your grandparents' age?
Yeah.
If you're over 80 years of age,
Mm,
1 in 5 chance that you're going to die if you get COVID. And in China, it was 15% of those in that age group died. So what's this got to do with our faith? What it's got to do with our faith is that when we think about loving our neighbors,
mm,
it means doing all those things that we're talking about with social distancing. You don't want to be a link in the transmission chain for COVID for somebody in the nursing home down the street.
yeah.
And it's kind of a weird thing, you know. I think our concept of what it means to do something heroic is kind of like this. It's kind of like, you know, this macho guy is carrying this woman and her child out through the flood, and actually the heroic thing to do right now is all the things that the CDC is telling us to do.
Mm,
This deal about washing your hands and covering your mouth and all of those things.
yeah.
It's a great way to love your neighbor.
Yeah. So even though you're not, 20, you're 20 years old or 25 years old and you're in that low risk category, sort of, I think a lot of people are past this point, but for sure at the beginning stages of this, I'm not at risk. But you could be a carrier of it. And do you love your grandparents? Do you love your parents? Do you love
Right.
the people, that mean the most to you that are, in older generations? And I think that's really profound. And I hope we're seeing more and more people really realize that. But I think it's going to be something important to remember as we see some improvements,
Right.
as we see some progress. Yet at the same time, we don't want to stop doing this too soon for the sake of our neighbor, loving our neighbor. Right.
Yeah. And I think we're also at a point where a lot of us are getting a little fatigued of this social distancing.
Mm-hmm.
And I think we want to say, yeah, I think I'm going to make an exception here. And I think, as Dr. Fauci has said, and by the way, I want to commend him because I think he's really looking out for our interests. He said, now's the time to put your foot on the gas. Like, we're starting to see this go away. Don't let up yet in terms of
throw away the
social
hard work that we've
distancing.
all done.
Yeah. We're going to get there, but we're not quite there yet.
Yeah. How would you say Christians should respond to the disruption caused by isolation and other protective measures taken?
Yeah. I want to share with you one other thing that's along those lines. And I think it's knowing what our support structures really are. Like, I think one thing that COVID has done is it's shown us how vulnerable we really are in a lot of ways. And it stripped us of a lot of things that we felt certain in, just like the stock market,
Right.
our health, our employment, I mean, you just name it. I mean, there are a lot of things that have really look a little vaporous right now.
Mm-hmm.
And I want to share with you another thing here. This is from the Heidelberg Catechism that I just love. And so this was Luther's catechism. And the question is, what is your only comfort in life and death. And I'm just going to read this because it's worth it.
Absolutely.
And you'll see that it's pretty biblical. It's well referenced.
Yes.
Our only comfort in life and death is that I'm not my own, but I belong, body and soul, in life and in death, to my faithful Savior, Jesus Christ. He has fully paid for all my sins with his precious blood and has set me free from the tyranny of the devil. He also watches over me in such a way that not a hair can fall from my head without the will of my Father in heaven. In fact, all things must work together for my salvation. Because I belong to him, Christ, by his Holy Spirit, assures me of eternal life and makes me wholeheartedly willing and ready from now on to live for him. And I've actually gotten in the habit, Scott, of doing something to try to merge some of the CDC guidelines with Scripture as well along these lines. And it's this actually. Yeah, here we go. I'm going to show you one more slide here. I don't know if you can see that or not, but when I wash my hands now, they say you need to do this for about 20 seconds. And so you could like sing the happy birthday song twice or say your ABCs or, these other things that occupy 20 seconds, or you could recite a Bible verse or memorize a Bible verse. And one that I think is particularly meaningful for me right now is Romans 8:38 and 39. And I sometimes modify it a little bit when I'm saying it. And it's kind of like, have you ever heard people talking about praying promises back to God?
Yeah.
So you can pray this promise back to God as you wash your hands, and it'll take about 22 seconds. And it's that I'm convinced that neither death, nor life, nor angels, nor principalities, nor things present, nor things to come, nor height, nor depth, nor powers, nor any other thing in all of creation, including the stupid coronavirus that's messed up everything, none of that can separate me from the love of God that is in Christ. And so when you're done with that, I think you can kind of say, wow, in all this kind of uncertain times that we're in right now, I've got clean hands and hopefully a little bit of a settled heart when I've prayed that prayer back to God.
Absolutely. Now that's a really creative way to keep that in front of you whenever, when we're doing these things that can seem, sort of rote and okay, I'm doing this a lot. My hands are very dry right now, but yeah. It's great motivation. Absolutely. So before we get to some questions from the audience, and I just want to remind everybody, you can submit your questions down there in the Q&A box at the bottom of your Zoom screen. So make sure if you've got a question for Dr. Thielman here that you do that. We'll try to get to those at the end of this call, depending on our time. Last question that we have for you before we move to those questions, Dr. Thielman, what does the future of fighting COVID-19 entail? And what are some encouraging developments that we have to look forward to?
Yeah.
Encouraging news is always good.
Well, I think we're kind of, by God's grace, I think we're kind of at that peak on the curve. And so I think we're getting there. As I said, I think we just have to kind of keep our foot on the gas right now. I think it's a time too to pull together. I feel like there's, people are really working hard to try to figure this out. A lot of, I don't think it's a time to be divisive, and keep on doing what we're doing. I'm hoping and praying that we're going to have some good therapeutics that are out there. I'm hoping and praying for a vaccine. I think there are going to be diagnostic tests where we can figure out who's been infected and who hasn't, which might mean that they're immune down the line. And so then those people might be able to engage more. There are a lot of things that are going to have to be worked out. And I think we as Christians need to fully participate in the way that our country is trying to work our way through this, and be team players in this. I think it's important for our witness, frankly.
Mm-hmm. Mm-hmm. Absolutely. Well, I think, very related to that question is our first question from the audience here tonight. It's from Eric, and Eric is asking, if isolation were to continue for an extended period of time, could this isolationism, this need to isolate, lead Christians in being disobedient to their calling, such as spreading the gospel to unreached peoples or exhibiting a physically demanding spiritual gift such as hospitality? I think it's a very spiritual question, but I think a good one.
Yeah.
Maybe you can speak to.
Yeah, it's a great thought. Like, what does it mean? Because there's no precedent for this. I mean, maybe the 1918 thing, but certainly when you look in Scripture, it's kind of hard to think about it. I mean, maybe, I don't know. I hadn't really thought about it before, Scott. What it was like for someone with leprosy, and
what do you do?
Physical distancing. I think, I mean, thanks be to God, we've got Zoom. We've got ways that we can be physically distanced but socially connected, and try to be encouraging to other people and be good friends in that way. How do you demonstrate hospitality in a socially distanced?
Yeah, I mean, I think
setting?
We get creative, right? It's and the Lord will make a way, I think.
Yeah. Yeah. I think, I mean, I think sharing with others is one way to kind of think about it. Not being stingy, we've seen people that have been hoarding, right? And so when we've had resources that we've been able to, maybe we were just kind of smart and we went to Target earlier than everybody else.
Yeah.
And then our neighbor has a need for something, says, here you go.
Yeah, there are creative ways for sure.
Yeah.
The next question we have is from Christina, and she asks, how effective is the hydroxychloroquine plus zinc cocktail that we've been hearing about? How effective is that really for treatment of COVID-19? What are your thoughts on that?
Yeah. Oh, man. So I don't think anyone really knows. I think that's the bottom line. There's something called randomized controlled trials that actually need to be done to figure out if something is really safe and effective. And so we don't know. I mean, there's certainly some theoretical reasons to think that hydroxychloroquine could be helpful, because like in a test tube, it seems like it inhibits the entry and replication of the virus within certain cells. But it's hard to know if that actually translates into something meaningful clinically. And there are some toxicities with hydroxychloroquine. There was a study just in Brazil where when they were given higher doses, they saw more arrhythmias. And so you have to enter into this very carefully and make sure that it's done in the context of a very controlled environment where people are being monitored to assess not only efficacy, but also safety issues. So it's just a little bit early to tell.
Under the supervision of a physician, of your doctor.
Right.
Right.
Yeah, for sure.
Yeah. We have an anonymous question here. There was no name linked to the question, but in China, wearing masks and protective measures are common. Dr. Fauci mentioned that we should be more like them in the future and possibly avoid even shaking hands in the future, even when this goes down. Do you think that those are realistic ideas?
Yeah, that was interesting.
That's a tough one, not shaking hands anymore.
Yeah, that's interesting. I would forego shaking hands if I thought I was going to be a vector to transmit this virus to somebody who is vulnerable. And I think what we don't want to do is we don't want to be cold to someone. So how do you make up for that? Like if you can't shake someone's hands, Um, um, how do I express, hey man, it's great to see you. We're gonna have to improvise.
Before it
Yeah.
became really, before social distancing was a thing, everyone was sort of doing this, and now it's like, hey, 6 feet away, hello.
No, so it's kind of like doing the air elbow bump or something. Maybe we'll do a little chicken wing thing from 6 feet away, and that'll be our new greeting. I hope, I think this is temporary. But for right now, yeah, I don't think we need to be doing it.
Yeah, that makes sense. Katie asks, have you ever had a moment in your practice or your treatment of these illnesses where you asked, God, why? Why is this happening? That it's made you sort of maybe question your faith, or maybe not even question your faith, but just sort of ask why.
Yeah, for sure. I haven't seen enough COVID patients that I've the weight of that has come on me yet. I think it likely will.
Mm-hmm.
But certainly during Ebola, and certainly with AIDS, I've seen that, where you're just thinking, holy smoke, like that just didn't, yeah, I don't understand that. And I don't think we have to have all the answers when we see suffering like that. I think what I can do is I can say that there's a God who has suffered, and a God that shares in our suffering
Mm-hmm.
and loves us, and kind of lean into that as hard as I can in those moments.
Absolutely. We have a couple of students asking, is it possible to get COVID-19 twice?
That's a very good question. Um, there are some reports out there from Korea that I've heard about where someone had COVID, had a negative test, and then had a positive test. And I think the reality is we're not quite sure what's going on there. There was a famous graduation speaker at a Harvard Medical School class who said that 50% of what you learn in medical school over these past 4 years is actually wrong. The problem is we don't know which 50% it is.
Right.
And so I think with a lot of these things, Scott, that, we don't have a lot of great information. And so whenever we see these stories, I talk about confidence intervals. Like, the truth is somewhere between here and here, and hopefully as we get more data, we get closer to what the truth is.
Mm-hmm.
My hunch is there could be a couple of things going on with those scenarios, and one is that maybe it's a false negative test that got them out to begin with.
Right.
Which is not necessarily comforting either, to think that there could be some false negative tests. And that they're just shedding virus for a longer period of time than someone else. Otherwise, most respiratory viruses like this, you're going to get sick, you're going to recover, you're going to have neutralizing antibodies that are typically protective against future infections. But we're only a few months into this, and so I think we have to say I'm not entirely sure yet.
Yeah, the limited amount of information. This is literally, with this particular virus, never happened that we know of. So yeah, it's new. Along those same lines, similar lines, Cole asks, I've heard of the possibility of a second wave of COVID-19 after the curve settles and before a vaccine is developed. What are the chances of this happening, and could this really happen?
Yeah, I think it could happen, and I think it's a valid concern. I'm gonna share with you a screenshot for a second, and this tells you why I think this could happen. So this is actually from the book that I was referencing earlier, The Rules of Contagion.
Yeah.
And this is from the 2009 influenza pandemic in the UK. And what you see are the number of cases going up, and then there are the summer holidays, and people are kind of scattered they're not in their schools, and then they come back together and the cases go up. I'm not saying that's going to happen with COVID,
Mhm.
but I think it's a real possibility, and it's a concern as we relax the social distancing, that we may see another wave or two.
Yeah, hopefully there will be some sort of mitigation tools that we're hearing about to be able
Yeah.
to help lessen the impact of that. On that same note, Hannah is asking, how much longer do you think it will take before a vaccine is developed?
Yeah, another great question. I listen to Fauci as my, he's the expert, and he's been doing this for years and years. And I think he expresses a lot of optimism and says, maybe 18 months or a couple of years. I will also say that, I've been doing HIV stuff for a long time, and there's been a lot of talk about an HIV vaccine, and it's been around for a long time.
Mhm.
Now HIV is it's a lot of different in a lot of ways, in the way that it's really tricky to develop a vaccine. The immunologists, I think, are pretty hopeful that they can come up with something for coronavirus.
Mhm.
Um, but I don't know for sure. I think we're probably, I would say in a year and a half to 2 years away would be my
Wow.
guess.
Wow.
Yeah.
So a lot of mitigation, techniques and other ways besides vaccines. This is not going to be released in 3 months.
Yeah, I mean, it takes a long time to prove a vaccine is effective, and it's got to go through, various phases of safety evaluations, et cetera. So even if we had in the lab the vaccine today that
Mhm.
ultimately will be the vaccine that'll work, you don't know it until you've done a lot of studies. And so that's just kind of the nature of research. That said, I'm hopeful that this will break the record, because there's so much attention and focus going on this from around the world,
Yeah.
that I think there's reason that to hope that this could be, that we could have a vaccine at a record pace.
Hmm. Absolutely. Along the same lines, this is a question from Joni. She asks, do you have a specific infection rate when the economy should ideally be reopened? What are the signs, in other words, that the economy can be reopened?
Yeah, that's a really good question. At the end of the day, I think I'm going to say I'm going to trust the process. I think uh,
Mhm.
Dr. Fauci and Dr. Birx are really thoughtful, good scientists who make evidence-based recommendations, and they're going to do their best. And I have a lot of faith in them. I think that, one of the things that you have to think about with the flattening of the curve, what that actually achieves is keeping our hospitals from being overwhelmed. And that's a great thing. But what ultimately makes an epidemic go away is when there's something called herd immunity. When
Mhm.
enough people have developed antibodies against the infection, so that if I'm infected and there are 3 of us in the room, and 2 of the other people in the room have antibodies, then there are fewer, the Arnott goes down, the ability to infect another person goes down. When that number gets below 1, the epidemic goes away. So one way or another, what we need to see is immunity being built up uh, uh, in the population for this to ultimately go away. How you make the calculus of when to open the economy, and what is that going to do in the hospitals, is a really tough call. And it's a reason we ought to actually, I hope we're all praying for our leaders that
Yes,
they will make a
absolutely.
good decision here.
Yeah, that they'll have wisdom.
Yeah.
Absolutely. Well, this is the last question we have tonight. This comes from Fiona. She says, I'm an aspiring medical student, and I'm currently studying for my MCAT, which has been postponed to a further date. Any advice on how to keep up the studying? I'm sure you've done that in your past as well. Maybe not under the coronavirus epidemic, pandemic, but you've studied for that before. How do you keep up the studying and keep up, the faith through though the end date for this test is unknown?
Yeah, that's a great question. Well, first of all, that's really heartening to hear, and keep us posted, Fiona, on how things go. Practice, practice, practice. There, as you probably know, there are these very thick books of lots of practice questions for the MCAT. Same with kind of the LSAT and others, or maybe they're online now. I'm showing my age, but yeah, I think just kind of practicing and working through those questions is really important, and taking breaks too. I mean, you got to be, it's a tough environment right now, and you got to be mindful of kind of your own well-being in this. My brother's a psychiatrist, and he's. I was talking to him the other day, and he said, there are two things you can do immediately that'll make you feel better. Said exercise and do something for someone else. I thought that was really good advice when you kind of got the social distancing blues or the MCAT studying blues.
I think that can apply to anybody who's, in school studying. Maybe you're finishing up your degree. Maybe this is your last semester, or maybe, you're earlier in college, or maybe you're out of college and you're working like all of us from home. And you've sort of got, like you said, the social distancing blues. And I think that's great advice for all of us, for sure. Well, Dr. Thielman, thank you so much for joining tonight. Your time is very valuable, and we're incredibly honored to have you here with us tonight.
Well, it's my pleasure. Yeah, y'all stay well.
Absolutely. And everybody out there that joined us, thank you so much for joining us. We hope that this has been encouraging and informative. Make sure to follow us, follow Passages at Passages on Facebook, Twitter, and Instagram for more updates. And stay tuned for next week's speaker. We have our wonderful friend, Father Roger Landry. It's going to be a fantastic webinar next week. Have a great night all. Be well, and God bless.